Aloha, I'm Yanji Denise. Welcome to Get Your House in Order, the show where we help you take care of the things that matter most. In this series, we cover a wide range of topics from health and wellness to financial readiness and preparing for every phase of life. When Americans turn 65, they're eligible for Medicare, but how do you know what coverage is right for you? We're going to be speaking today with a benefits consultant about how to pick the right plan. But first, as always, we're joined by Paulette Ito of Hawaiian Financial Federal Credit Union. Good to see you, Paulette. And this issue is really at the core of what we're talking about in this series.
Absolutely. Getting your house in order is very important to be able to be prepared for life and be able to be comfortable with what you have. And by getting your house in order, you'll be able to see what you need and what you need to do to get prepared.
Yeah, and there is so much. How do people get started? Where can they learn more?
At our credit union, we put together a guidebook called the Ho'okele. This guidebook will walk you through all the different steps of getting organized. We have it broken down into 4 phases. Phase 1 is the past, things that you have, who you are, your nationality, your different medical records. The other will be the present. Then we'll do the future, and then we'll talk about miscellaneous. So it's going to be a series, 4-part series, and every quarter we'll come up with a new guidebook. And you can come to our website at hificu.com to download it.
Okay, and why is it so important to document this and to really start this process?
Well, you don't know what you don't know, and you only know what you plan for. So by doing this and putting your guidebook together, you'll be able to see everything and identify gaps. So if you have gaps, such as, I haven't planned for Medicare, or I haven't planned for long-term care. What do I do? How do I get to do it? Because it's a plan. It's a guidebook to get you from where you are to where you want to go. And then you'll be able to see all the gaps in between.
Okay, and why did the credit union feel it was important to launch this guidebook?
We felt that this was a need in the community. We looked out and to see if there was financial literacy that would help our community. And we could just find balancing your checkbook or, how to plan for retirement. But this is much more. This is going deeper. When I talked to my board about it, I said, this is the 600 level of financial literacy. This is above and beyond. This is the master's class. Okay. And we thought our community needed it.
It is what we all need. Thank you so much, Paulette. Now, wouldn't it be nice if someone could actually walk you through all the Medicare options and help you make a choice? We're going to be speaking with someone who does just that after the break. But first, let's hear firsthand on why it's important to understand these benefits inside and out.
Aloha, my name is Lynette from Honolulu, and this is my story. I was very fearful to go over to Medicare, so I delayed it for many, many years. I continued to stay on my husband's insurance plan. I had met my Medicare agent, Mark, several years before I was qualified. And what was great is he followed up with me all the time until finally my husband said, maybe we should really look into Medicare. He was qualified for it, and our agent Mark came and sat down with us and took the time to go through all the different plans and programs very patiently. He's very knowledgeable, he's very patient, he's very kind, and was able to answer all of our questions. I would highly encourage people to not be afraid of Medicare because the programs are very good. You can choose your coverage. There's so many different plans that you can go with. Get the right agent. I was fortunate enough to have Mark. He follows up with me every year. So if I had some advice to give you is don't hesitate. Look into your Medicare plans today and get signed up.
For all your money needs, Hawaiian Financial Federal Credit Union is here for you. Visit hificu.com.
Welcome back. We're joined now by Mark Faildo with Premier Benefits Consultants, a company that helps people figure out the best Medicare coverage for them. Mark, I know you've been with this company for over a decade now, so you know this topic inside and out. Tell us a little bit about the services you provide.
Yeah, thanks, Angie. So what we do is help folks that are Medicare eligible either come into Medicare, and then when they do have their Medicare in place, help to add those things called either supplement or advantage plans. These plans help to drive down costs as well as complete Medicare coverage. And we do this at no cost to the individual, as we're compensated equally by every insurance carrier that we represent. So there's never any bias. What we're after is making sure that the folks end up with the right fitting plan for themselves at that time of their lives.
I think that's such an important point to drive home. You're not making money off the individual, and you have no skin in the game in terms of which service they choose.
That's absolutely correct. Yeah, it really matters as people's health changes, or perhaps even their plans change, that we are there to help them understand that they've got the right fit. And these things happen yearly.
Okay, and so when should someone start to think about Medicare coverage?
Well, Medicare typically begins at age 65, so we always would recommend that you take a look at this around 62, 63, but especially right up at 64. There's some things that they're going to want to get involved with, like, for instance, thinking about coverage beyond 65. And many of times people need to consider, well, what am I doing at 65? Am I still working and covered by an employer plan? How is that going to intertwine with Medicare? Or perhaps they've got something else like retiree benefits or TRICARE for life for military retirees. How is that all going to pair up with Medicare itself? So yeah, to answer your question, around 64, that's when things really get going.
Okay, and you did mention private insurance, so some folks may still be working. Does everyone need to get Medicare?
Well, that really depends. So that's a loaded question. There are examples of people that may never participate in Medicare. I'll give you an example. A federal retiree has an opportunity to, but they don't really have to if they don't want to. It's always recommended, though, that people take part in Part A of Medicare, no matter their situation, as Part A is the premium-free part of Medicare. So whatever that is, get Part A. Your tax dollars have already paid into the system enough for you to receive those benefits. And then think about whether or not you need to get the rest of Medicare, those other parts.
Well, let's talk about those. Part A, we know, is the sort of base level, but what are the other parts?
Okay, so Part A, coming back to that, right, is your inpatient coverage. It'll help you with staying at a hospital or skilled nursing facility. It also helps with home health care and hospice benefits. Part B is the outpatient part of Medicare. That's the part that's going to get active when visiting doctors, taking a blood test, riding an ambulance, or going to an emergency room. Those two parts are the only two parts that the government continues to manage. C and D are the other two parts, but these parts come through private insurance companies. And Part C is also known as Medicare Advantage. Part D is for prescription drug coverage.
Okay, and so what doesn't Medicare cover?
That's also a great question. So Medicare in itself will not help cover routine eye exams or help to pay for eyewear. It doesn't cover dental benefits. Hearing exams or hearing aids are not covered. Long-term care, that one's a real big misconception. Long-term care is not a covered Medicare benefit. And the last one, medication. Medication coverage doesn't come through having Parts A and B, as I mentioned, it's from Part D.
Okay, so in that case, you could get supplemental coverage. Is that how you'd sort of fill in the gaps? Because those are a lot of things that a lot of people need.
Exactly, and that's exactly what we do. So when it all starts with having Medicare, but once you have that, we're going to ask questions that help us understand your needs, who your doctors are, what medications perhaps you might be taking, and utilize those pieces of information to do a needs analysis with coming out with several recommendations as to what you might want to add to complete your Medicare coverage.
Okay, and you did mention that there's a misconception about long-term care. What other issues do you find that people don't realize? You know, what are some of the main misconceptions around Medicare?
Yeah, you'll hear people talk about, I thought I had to get Medicare because of these penalties, and they actually do exist, Medicare penalties. A misconception would be that you had to participate right up at your 65th birthday month. But that really just depends on your situation. There's an ability for people to defer participation in Medicare if they still have creditable medical or drug coverage provided typically by their employer.
Okay, lots more to talk about with Mark. Stay with us, we'll be right back.
When to start thinking about Medicare. As you approach retirement age, you should start examining your healthcare coverage beyond age 65, whether you're still working or not. Premier Benefits Consultants helps people understand how their other coverages, like continuing employers plans or retiree benefits, will fit with their Medicare coverage. Does everyone need Medicare? It's always recommended to get Medicare Part A and Part B, the federally administered parts of Medicare, because we've all paid into the programs to receive those benefits. Whereas Part C, Medicare Advantage, and D, prescription drugs, come from private insurance companies.
Long's Drugs is always here for Hawaii, providing your family with their local favorites, accessible health and wellness services to keep you safe and healthy. Make Long's a part of your day. Beachside Roofing, the leaders.
Welcome back. We are speaking today with Mark Faildo about how to navigate the complex world of Medicare. You know, I think a lot of us have heard about this coverage, but we don't quite understand the specifics. So how do we complete our Medicare coverage? You hear that a lot in commercials, but I personally don't really know what that means.
Right, so there are products that are available by private insurance companies that help people to do this. These products include a Part D prescription drug plan or standalone prescription drug plan. And furthermore, as an option, you could add what is called a Medicare supplement, sometimes known as a Medigap policy. Those types of plans aim to do one thing and one thing only, is to help pick up the leftover costs that would occur after Medicare pays. So that can be considered to be secondary insurance behind original Medicare. Another option may be Part C, Medicare Advantage. And to put it simply, Medicare Advantage is a way that a Medicare beneficiary receives their Medicare benefits, but delivered through a private insurance company. Many of times these types of plans do more than just original Medicare and will drive down costs with also providing those other things that Medicare does not provide. Commonly vision, dental, hearing, perhaps benefits could be included in a Medicare Advantage plan along with prescription drug coverage. So those products are on the market and available.
Okay, so let's say I sign up, but now I realize that I need more than I signed up for, or I have more than I need. How easy is it to change a plan?
Yeah, very easy, but only during one period of the year. And that's called Medicare's annual enrollment period, which always happens October 15th through December 7th. It's a 7-month window where people are encouraged to take a look at their current coverage. They'll also be provided how their plan may be changing for next year. And they also should be considering changes in their health. If perhaps they're going to be going to doctors more often or requiring a certain kind of medical procedure, maybe a change in their medication lineup. So these kinds of changes, those variables are what we educate people on. Try to make sure you think about those things so you make a great choice about your Medicare plan for the following year. Remember, you're doing that for a year at a time. So once those changes are occurring, it's going to be that plan that you'll have for that upcoming year.
Okay, and as people transition over, I think a lot of us are attached to our healthcare provider. These are relationships that can last for decades, and you don't necessarily want to go to someone new. So how do you make sure that you keep the providers that you like?
Yeah, exactly. So one of the biggest components about making a great decision would be to make sure that the plan of choice is accepted by your provider. You can do that by going to their provider's website, the insurance company's website. They oftentimes have a provider directory that you can look up, or they can call me and we can go ahead and take a look at whether or not the doctor accepts that line of insurance.
Okay, I know that you probably speak to a variety of people. You hear a lot of stories. What are some of the biggest mistakes people make when they start off on this process?
Yeah, starting too late, and that can cause a gap in coverage. That's common, that they didn't realize it takes a little bit of work to get Medicare going. We always recommend at least 2 months prior to you actually coming off of an employer provided plan and onto Medicare. In those situations, either they'll go through a period that they don't have coverage, or perhaps then being forced to purchase something like COBRA, which is astronomical in terms of cost when you compare it to what you could have paid for Medicare.
Yeah, and I think there's this perception that I turn 65 and it just sort of happens. It's not automatic.
For those collecting Social Security prior to turning 65, it actually happens automatically. You'll be sent your Medicare card without lifting a finger. But many people don't collect Social Security prior to turning 65. You actually have to take action to get Medicare going. And the earliest they'll allow to do that would be 3 months away from your 65th birthday month.
Okay, still so much to cover. We have much more to discuss with Mark, including the difference between Medicare and Medicaid. Stay with us. We'll be right back.
Avoiding common mistakes. Some people wait too long to sign up, which can lead to gaps in coverage. Unless you are collecting Social Security at age 65, Medicare enrollment is not automatic. You have to actively apply, preferably 3 months before your 65th birthday. Difference between Medicare and Medicaid. Medicare is available to anyone over 65 and is administered by the federal government. Although federally funded, Medicaid in Hawaii, or QUEST, is administered by the state. Medicaid covers many things Medicare does not, including long-term care. Those qualifying for QUEST coverages fall below a specific threshold of income and assets. It is possible for someone to have both Medicare and Medicaid.
Impact Wealth Solutions. Dream, plan, live.
Welcome back. Mark Faildo of Premier Benefits Consultants is here to walk us through the options for Medicare. Now, we know a lot of coverage is out there, but let's talk about the difference right now between Medicare and Medicaid. We know these terms, but we don't necessarily know what they are.
Yeah, sometimes they get intertwined and confusing. So Medicare, administered by the federal government, people qualify for Medicare typically based on their age at 65, right? Medicaid is administered, although federally funded, by the state of Hawaii. So each state has their own Medicaid program. We call ours QUEST here in Hawaii. To qualify for QUEST, someone is going to be asked about their income and possibly their assets. Medicaid can exist with Medicare. Someone can have both Medicaid and Medicare. We call those dual eligible. In that sense, Medicaid does several things, including could be paying for their Medicare premiums as well as their Medicare co-payments, things that Medicare wouldn't pay. Also, it could provide coverage for things Medicare does not, in particular, long-term care. That's how people are able to go ahead and get some help with those expenses.
This all feels so complicated. Why is Medicare so complicated?
You know, it's a great question also, but I think that it makes it less complicated if you're understanding the basics. But that's where I think and why people get a little bit confused, because each individual has different needs. They come with different things. As I mentioned, perhaps they've retired from the military or some organization. And it all depends on that individual's needs as to how it's going to intertwine with Medicare. So at its face, Medicare Basic is pretty simple, but where the complexities come in is adding things and how does Medicare intertwine with what you already have, if you have something.
You know, medical information is so personal and we want to keep it private, but when we're shopping for these options, we might be sharing some of this information. How do you know what's appropriate to share and not to share, and how do you keep what you need to keep private?
Exactly. So, you know, your Medicare card is something that you should treat like your Social Security number, right? And in fact, 3 years ago, Medicare changed up using people's Social Security numbers as their Medicare number. So they went through a whole transition. Nowadays, their Medicare number is a random set of numbers and letters. Still, you wouldn't want to go ahead and share that information generally. I mean, if you are at a provider office, your doctor's office, then absolutely. But don't, answer the phone and give that information freely. That's as important as your Social Security number. We want you to safeguard that.
Okay. What resources are available to learn about Medicare? I know that, in my own family's case, when my mom turned 65, she just started watching YouTube videos. I'd imagine that's not the advice you'd give.
No, that wouldn't be. You can get information in a variety of sources, credible sources. I would say that the best source would be Medicare's website at medicare.gov, medicare.gov, or Medicare beneficiaries every year are mailed what is called the Medicare and You book. It's your Medicare Bible, basically. You want to go ahead and read through those pages to be able to completely understand your coverage. We hope that they may be able to take advantage of our services as well. Call us with your questions. We'd be happy to go ahead and answer either just basic Medicare questions or, hey Mark, am I in the right plan at this time of my life?
Right, because it's not too late to change it. If you've signed up, if you do have that benefits window.
Absolutely. We always say it's temporary. You're able to do this on an annual basis, and so don't think that your choice or your decisions are forevermore. You'll be able to modify that every single year.
Okay, and just a final piece of advice for folks who are starting out on this process, or maybe in a circumstance where they feel like, oh, I don't really have the right coverage for me at the moment.
Well, I would say that, it's never harmful to go ahead and look into what am I paying in terms of copay with my current plan? Have I had trouble getting to see a certain doctor I wanted to see? Boy, my medications are costing a whole lot more. These kinds of things are common and things that you should consider before making, again, that decision about what plan you should belong to. We'd like to invite people to go ahead and take advantage of our free services to get that help, right? It's our job to go ahead and sort through all those pieces of information to ensure that people are in the right place.
And fantastic to know that it is free. Mark, thank you so much for joining us today. We did learn so much. Remember, you can review this show or watch it again by finding us on YouTube. You can always listen to us as a podcast wherever you get your podcasts as well. I'm Yenji Denise. Until next time, take care and aloha.